as we implement these efforts and strategies. So our next speaker, I'd like to introduce Dr. Ali Mostashari. Dr. Mostashari is the co-founder of LifeNome, a genomics AI or artificial intelligence company based in New York City. His experience includes serving as assistant professor at Stevens Institute of Technology and directing the Institute on Smart Cities initiative and systems thinking approaches there. His presentation today will be on nutrigenomics, and welcome, Dr. Mostashari.
Hi, everyone. I'm usually not used to standing in one place. I just usually pace when I'm talking. So in this case, you'll kind of pardon me. I would like you to take just 30 seconds to stretch a little bit, take a breath, stand up, and I'll tell you why I'm asking you all of this. Just wonderful. So one of the nice things about being third speaker is just it's an interesting stat to understand that after in the third session you're around 55% of your normal attention span. So when you start at 9 a.m., if that is you're already at 90%, given our distractions that we have. Right now you're at 55% of that. And stretching does help in that sense. And what they say is in terms of retention, you will always take away anywhere between 3 to 5 points in a kind of span of 3 hours, right? So I have to push my points into my colleagues' points so that you get 1 or 2 of my takeaway points as well as we go forward in this presentation. So today I'm going to talk about nutrigenomics, in particular nutrigenomics that is powered and informed by artificial intelligence. So one thing that's very, very important to understand is this particular presentation is packed with a lot of information. I do not expect you to retain all of this information, just the general concepts of nutrigenomics and understand how it might be helpful in your work as it pertains to guiding individuals, patients' nutrition. So basically, now I learned I have to point there. Basically how genetics impacts dietary responses, it can do so in many, many different ways. Each of us have predispositions that change the way that we respond. We heard before that some people could potentially eat the same amount of food as others, and their body response might be different. I've always had this sense that I basically eat nothing and still I gain weight. And guess what? After we started our work on nutrigenomics, I realized I'm at the 95th percentile of tendency for overweight potential. My entire family is overweight, so I need to work very hard, much harder than other people, to keep it down, and this is the worked version that you see. So this is basically kind of like a major challenge. So each of us could have different kinds of genetic variations. That means particular allele expressions that make us more predisposed to one thing versus another. And that's how we can both have very different needs and very different processing of both macronutrients and micronutrients in our body. Anything from, if you know, lactose intolerance or gluten sensitivity. Now, of course, right now, what percentage of people here eat gluten-free food? Just raise your hands. Okay, and so there are different levels of sensitivity to gluten. Not everyone is sensitive to the same level, but again, there are genetic factors contributing to that. Same thing for lactose intolerance. Same thing for alcohol response, caffeine metabolism. Lots of different things are different between each of the people who are here And not all of that relates to the fact that we're from different races or backgrounds. It's actually at an individual level. So understanding that is very important, in particular if you're guiding patients through nutrition, be it post-cancer, be it for chronic disease management or prevention in many different ways, and in particular for women's health, pregnancy, fertility, for menopause. All of these make huge, huge differences. So understanding that is very important. And the only thing I need you to understand here is a very simple concept called SNPs. So SNPs are variations when people tell you what impacts the fact that there are variations between different human phenotypes, meaning how we all look different. These are SNPs. It's more complicated than that, but given the fact that I'm the third speaker, I'm just going to kind of stick to just remember the words, the SNPs part. Great. So what is very important is to think about how do we actually provide patients with personalized. There's two aspects to nutrition. One aspect is the population health level. So population health level is where Dr. Lustig works on. It will help everyone if we reduce sugar intake. That will be universal across, no questions asked. And then there is at the individual level, or sometimes at the group level, it is very informative to have an understanding of how to personalize the nutritional needs for different people. So based on that, you can, once you have an understanding of what kinds of different factors contribute to a person's needs and how a person's actual lifestyle is impacting the expression of their genetic predispositions, becomes really important. So there's two things with nutrigenomics. One is, what are you born with? What kind of predispositions do you have? And the second one is, how does your current nutritional lifestyle activate particular genes, expressions that may be dormant? So two different sides. We're born with something, and then our lifestyles impact the way. I want you to kind of keep those in mind. That's key takeaway point number 2 as a simplified thing. So obesity, very strong genetic component. Sometimes individual genetic components, sometimes intergenerational genetic components. Something that is currently being investigated is the unfortunate intergenerational nature of inequity. So during, I'm just going back several hundred years, during the era of slavery, when they brought people from Africa to the United States, they came from Western Africa, Central Africa. The diets were very diverse, but they came to the US and people were fed very poor nutrients, mostly corn-based, which they did not have the enzymes to process. They did not have they were not used to that food. Over several generations, what happened was epigenetic changes that became kind of entrenched as genetic variations over time that resulted in problems with carb processing within the African American population, resulting in obesity issues that we do not see in West Africa and Central Africa. So imagine that a person today is still impacted by intergenerational inequity several generations ago. And this is on the one hand really tragic and unjust, but on the other hand, it also tells us something different on the more positive side. If we start changing our behavior right now, within the next generations, we are able to basically epigenetically start changing the way our children's generations start responding to these things, right? So also take away the fact that genetics is sometimes doesn't evolve just based on millennia or hundreds of thousands of years, but sometimes because of factors that are kind of social factors in shorter periods of time. We see significant amounts of genetic influence on things such as obesity and type 2 diabetes. Cravings, a lot of cravings that people feel for carbs, for sugar, the gut, the mind, satiety, all of those A lot of those are led by genetic variations and by the impact of your genetics on your microbiota. So a lot of it is really not the will. It's actually the biology that's driving many of those dynamics. So what do we, the way to think about it is then how has genetics impacted us, but also how can our current nutrition impact genetics? And this is where the bioactive nutrients issue becomes important. So I'm just going to talk about 3 that are really important here, but there are, of course, many, many more. Omega-3 fatty acids, they can actually downregulate genes involved in inflammation. And as we know, inflammation-related genes can result in a wide range of pathologies. Polyphenols, they're present in fruits, vegetable teas. They can modulate definitely genes that are associated with metabolism and chronic disease prevention. And fiber, of course, amazing for your gut health. They're related to basically metabolism, gene expressions that relate to glucose and lipid metabolism. So on the one hand, you have the gene expression. On the other hand, you have the impact on bioactive food on those gene expressions. Both are quite important. What's interesting is the area of epigenetics. Epigenetics is an emerging area. We don't have that as much understanding of epigenetics as we have of genetics, but many changes that occur, not at the DNA level, but a lot of times changes that have to do with histone modification. Histone is basically the encapsulating protein of the DNA, and the basically characteristic of histone makes it easier or more difficult for genes to express themselves. So when there's a modification, either methylation or acetylation, that will change if a gene will express itself in one way or another. And so these epigenetic mechanisms are really important for us to both understand the concept, the natural concept of aging, but also issues such as disease, how we can kind of deal with these different kinds of disease. So even if your DNA has predispositions toward particular diseases, your lifestyle can downregulate those predispositions. That's extremely important. So genetics is not deterministic, it's a blueprint. What you do with it is the most important thing. And understanding it is critical because once we understand your baseline, we're much more likely to be able to do things that are specifically useful to your needs rather than just generic things that might be good for other people. So the same way that we know medication doesn't work the same on on everyone, that same fact is true of every other nutrient and every other chemical that enters your body. And what's very important is your microbiome, your gut microbiome, is impacted with a wide range of things. Definitely your diet is an important part. Your genetics is extremely important. Your formative months within, when you're basically in the placenta, extremely important time in terms of what happens to your gut microbiota. But again, what I was talking about with regards to the mother's health, mother's kind of lifestyle impacting children becomes really important here. Extremely, extremely important because it can have a multi-generational effect. So changes, if you were working with a mother, expecting mother that was potentially had complications with regards to potential diabetes or other things, and were able to they were able to work with their weight, reduce their weight, change their lifestyle, epigenetically that could, our sense is that that could impact not only the child, but potentially multiple generations down the road. And this is still a very active, and that would impact their microbiota. This is an active area of research. So basically, when you think about, when you think about the area of personalized nutrition and how it might impact the way you want to work with patients, It has to do with understanding the baseline genetics of the individual, how they process micronutrients, how they process macronutrients. Fat processing is very different. We have significant amounts of differences amongst people's carb processing, fat processing, protein processing. So it becomes really important because a lot of times we tell people, eat this, do that, and it's not a one size fits all. Even the Mediterranean diet, which we've noticed is really useful for more than 80% of individuals, is still not effective for another 20%. So there's really no silver bullet in terms of dieting, although there are generally good principles that would kind of possibly impact everyone positively. The degree of those positive impacts are not the same, right? That's extremely, from my perspective, very important. So there's some important issues to consider there. In particular, if you're working with people who are going through chronic disease management and prevention, you basically need to take a look at their macronutrient processing, their sugar metabolism, their insulin resistance levels. All of these are pretty well established research. The reason I'm not going into it right now is I was told I only have half hour to go through this entire presentation to make up for the time lost in the morning. But also, you are not right now in a position where you would absorb all the different names of the different genes and how they would be impacted. A lot of that information is available in the presentation. Once you go through it, I'm kind of skipping some slides for you not to be overwhelmed by it. I want you to get inspired to understand that we are at a stage within science where, with the knowledge of microbiomes, with the knowledge of genetics, with the knowledge of methylation, epigenetics, I want you to be familiarized with these words, with these terms, to be able to then later on go and able to do research on them to see what's available. With that, we have now the opportunity to be able to personalize the interventions that we have for different people with regards to the nutritional plans that we provide for them. And this is now pretty accessible. So a $100 genotyping test can give you so many insights about a patient's genetic predispositions that would have been impossible around 20 years ago, where we spent tens of millions of dollars only to sequence one human genome, right? So you're now at that stage where personalization is not for the rich. It can be done for nearly every single patient who needs that level of personalization. So the understanding of micro and macronutrient needs assessments, gene ingredient interactions, what kind of particular foods does a person absorb better or worse, and personalized recipe recommendations based on the combination of artificial intelligence, genetics, and other personalization factors. So these are all within reach, and they're all available. Now, if you were to think about what would be some steps for physicians to start doing this kind of thing and integrate this into their practice when they're working with patients, or that could also be for registered dietitians as well. So both are pretty critical. Is first of all just understanding the basics of nutrigenomics. That's very important to understand what's going on, what are the recent advances. This field changes every year. So if someone was exposed to it 3 years ago, what they know is now half of what they would be able to know now. So you need to keep yourself updated on this all the time. It's going to be part of, if you're doing nutrition for food as medicine work, make sure to check in on nutrigenomics every single year to see what's new, what's happening, what's now better understood. In particular with regards to obesity, weight loss, a lot of those areas, type 2 diabetes, inflammation, extremely important. So understanding that is very important. Understanding what kind of genetic tests provide what. So there's a lot of hype. Unfortunately, we live in a, I shouldn't have said that. I wanted to say, unfortunately, we live in a market capitalism economy, but unfortunately may not be a necessary thing. But what happens is in market capitalism, people start marketing things that are not true. So there's a lot of hype around what can or cannot be said. A lot of times, claims that are made are not scientific. So it's always good to kind of take everything that's on the market with the way it's claimed with a grain of salt, be aware of what is possible, what's not possible, and be able to also tell your patients and educate your patients and your clients to understand what they're getting when they get into these nutrigenomics panels and everything else. And then collaboration with institutions. There are actually certifications that exist for nutrigenomics that people can get into. And hopefully there would be a possibility even to potentially offer it with the American College of Culinary Medicine. And again, your job is also to do patient education and engagement, because not all patients have the scientific capability to distinguish between good and bad science. And you're really like a great catalyst in making that happen. And of course, making sure that you have evidence-based practice. Just with regards to some ethical implications of this, all of this requires data. So you heard about AI and how it's being trained on data. It's becoming more and more difficult to train AI on data because of privacy issues, because of ethical considerations, and because of the fact that people have been abusing that data for a long, long time. There have been genetic testing companies that would sell you a genetic test for $99, take your data, sell it to the pharmaceutical companies. So after that, the people lost confidence in the entire system of this being something that they might do for their own well-being. And then sometimes things like data hacks. You don't want your genetic data necessarily to be hacked. It's not the most pleasant thing to have your genetic data hacked by people. In particular, there were, it's kind of like a very problematic thing if you, it's something that never changes, meaning that you can change your credit card if it gets stolen. You cannot change your genetic data once it's stolen, right? So it's a kind of an important issue, which brings us to the fact that more and more companies are moving to an area where your genetic data or your personal health data is held in a blockchain, and the company really doesn't access your data. Just sends a query, gets a response, produces a report, your data is untouched, right? So that's where the future is going with regards to kind of safeguarding that data. There's direct-to-consumer genetic testing. There are some regulatory issues and frameworks that are very important. What does it mean when you tell a person they have a predisposition to diabetes or to other things and they need to change their nutrition? So you need to be kind of very familiar with all of those regulations we're working there. So basically, just in terms of what we see in terms of advances, you have emerging technologies such as AI and machine learning, which are different than large language models sometimes. So large language models are great for text, but for systems biology, you need to use systems biology specific AI kind of algorithms and structures, which we're using right now. Integration with other omics fields, that includes basically genomics with microbiome and other areas of biological data. And of course, combining that public health and policy so that it doesn't become something just for the rich and for the people who can afford it, but also for anyone who is actually able to get that. So I'm going to kind of stop here just to make sure that you guys are not overwhelmed, and also with kind of concern for the time for this session, and maybe within the panel we can address more of those questions. Thank you very much.